Talking of which, that's a very appropriate segue to Dr. Seshagiri Nimmagadda, who is the consultant forensic psychiatrist and medical director at Thornford Park Hospital, who is going to talk to us about COVID-19 and what can you do for your mental well-being. Dr. Nimmagadda.
Thank you, Julian, for that introduction. And I thank West Berkshire Diversity Forum for inviting me. It's nice to be with all of you as a local resident. And I also thank Alice and Andrew for the discussions we had before this. And also, I mean, they took some of the concerns I raised to the local CCGs. I'll touch upon them. So coming to, I'll start with my own kind of experience. I'm a victim of COVID and my wife is a victim of COVID, and we were very early victims in March. And we were unfortunate. I mean, we were fortunate that we sailed through okay, but we were unfortunate that we experienced one of the worst form of COVID. It was very incapacitating, very debilitating. Fine, we all have that kind of illnesses, but the thing is, we have a healthcare system which would, cater to our needs, which would respond to that. But at that time, this is late March, early April, there was a meltdown. Apart from the emergency services, which were doing a splendid job, there is chaos. I mean, the GPs are not seeing anybody. They are saying if it is COVID, just ring 111. The A&E departments are not taking anybody. They're saying if you have got COVID symptoms, don't come here, and you don't know where to turn up. I think what concerned me at that time was, okay, COVID is a very contagious disease. It is a very infectious disease, but it is a medical problem. I'm having medical symptoms. If a hospital turns me down, if my GP turns me down, if nobody is willing to see me, nobody is giving to prescribe me anything, where should I go? So these are the dilemmas. Again, I'm more wiser now. I was angry at that time. I took it to Andrew and Alice, but nobody knows. There is no precedent for this. Nobody knows this is coming. Even if it is coming, I mean, we saw these viruses, SARS virus and so many other viruses which were all over the world, but we somehow thought we in the UK and in the Western world are immune to this. It won't come to us. So there is total lack of preparation. And it is understandable now, not then, but now, in the sense that it's only 100 years ago we had a pandemic. And for the first time, most of us in our lives were seeing what a pandemic means. It is just not a disease. We call it as COVID-19, coronavirus disease. It's just not a disease. It's a huge public health problem. It is a social problem. It's an economic problem. It's a political problem. Is there anybody in this world, is there a single person in this world where his life is not touched by this virus? I can say no. Everybody's life is touched in some way or other. And it is completely, overwhelmed all of us. But I think with that kind of introduction, let me talk about the positives. The positives are, I can see with my own eyes, because I run a hospital with 130 patients, and my patients are a prolific users of physical health in the local hospitals, and I have links with the community, and I can see myself that the services have improved tremendously. People have understood it. People have got together, and we are much more secure now. If somebody has COVID, I'm sure they will get a very good service. Of course, you don't have a cure, but we can treat it. We can treat the complications. We can minimize the risks. And also, if you are otherwise fit and healthy, if you're a young man, it's very unlikely that death will come. Having said that, everybody's individual composition is very different, but we are a lot more secure and reassured than we were in March, April. So that's one positive. The second positive is the news we got yesterday about the Pfizer vaccine. It is 90% effective, which is good news. And there are at least 8 or 9 similar vaccines in the pipeline, and I'm sure all of them are going in the same line. So the vaccine will come soon. So we will be able to take the bull by the horns. But realistically, it will be another 6 months we have to endure with this. We have to follow the precautions. We just have to be cautious. So just switching on to the psychological issues, it's just the disease, and it's not just the disease and its medical manifestations. It's the worry. Will I see the people who don't have COVID, which is a vast majority, because at any point in time it's only a small minority who are positive, but all of us worry, what if I get the COVID, and the fear of it. Then there is death associated with this because there is no cure. And all of us at some point in our lives have come across somebody who died of COVID, who is known to us, a friend, a family member, or a friend's friend, or somebody neighbor. So like that. And then we are more worried about our family more than us. What will happen to my family? What will happen to my children? And then as overseas community, as ethnic minority communities, we all have 2 families, one family back home and one family. So that is double the worry. So what is going to happen to my mom and dad in India? What is going to happen to my extended family in India? Or what is going to happen to my family in Nigeria? So these are the kind of worries we face. Then there is the issue about the job security. Some people are losing the jobs. There is unemployment. And there is this risk that, the BMAE communities, the Black and ethnic minority communities, have more risk of COVID. So that is an added worry. So these are all kind of, this worry is very, very kind of consuming and overwhelming. And added to that, we have the lockdown. We have number of restrictions, and we had a very long lockdown, and now we have another lockdown. And what would happen in this lockdown is the social contact, which is very, very essential for our survival as human beings, that is lost. And imagine a world without, the social communication. We luckily have all this, the interactive media and the electronic media. Imagine a world without this. It's unimaginable. You cannot implement a lockdown without all our Zooms and WhatsApps and all these messages. So the lockdown itself is causing so many additional problems. Say, for example, if you look at the BMAE communities, we celebrate our culture. Of course, Julian, you are a guest to some of our meetings when you're a mayor. So we have this Diwali, we have this Onam, we have this Ugadi, we have all these festivals. That is the time where people get together, you share, and that is very therapeutic. All these get-togethers are very therapeutic, and you lose all of them. Apart from the worry, you lose all these social contacts. And then the issue of working from home. Most of the people are working from home, and this leads to a completely new dimension. What would happen is, 2 professionals who are, you get your children to the school, and both of you go to your work, or one of them work from home. So you had that space for each other. Now you are almost locked down in your room, and it is like a mini Big Brother setup. The negative side of your personality and the darker side of your personality will come, and that can cause interpersonal problems, relationship problems. And I'm very saddened to say that, I was just before this meeting, I was discussing with one of my friend Ambu, who is also in this meeting. He was talking about somebody, known to him in East London. 2 IT professionals, both of them had very good jobs, had a little child. And with the lockdown, they were completely locked in their house. It is the first lockdown, and they are not going anywhere for weeks on end. And that caused a lot of friction between them, arguments, and probably in hindsight, the dad may be mentally ill, and what he ended up killing the wife, the little one, and ended up killing himself. So it's very sad and tragic story, but that is one of the extreme. But to certain level, all of us have these effects of the lockdown and the fear of this virus. It is multifaceted. It's like an elephant in the room. It means a lot of things to a lot of people, and some of them are completely unrelated. So, and then the worry and the frustration, the boredom, the loneliness, all can lead to some kind of helplessness, hopelessness, worthlessness, low self-esteem, and it's a sense of loss with no end in sight. I mean, that's why I started with the positives, saying that there is hope on the horizon. So, and these are all ingredients, excellent ingredients for mental illness that can push you on the brink, and that can push you into depression, that can push you into anxiety, and also it can cause panic. So how are we going to cope? How are we going to help ourselves in these situations? So I'll bring some of my personal experiences and some of my experience as a professional. I think the most important thing in these situations is support networks. We should be in some kind of support network. It's not just the social network where you just have the socialization. Of course, there is a social element, but a support network is something which will stand for you, both for practical help, for emotional help, for crisis resolution. Because I had that network, because a small group of friends, and being one of the first victims of COVID, not only that we are incapacitated, and we are also not allowed to go out because we can't, we have to isolate ourselves. And some wonderful friends, they brought everything. They brought the medicine, they brought the provisions, they would call us, they would check up on us. And that is what I think, that is the medicine we got. That is what helped us to survive. And again, within this support network, not only receiving the support, but giving support to somebody is so therapeutic to you. It has a meaning in itself. So I think having these support networks is very important, and a lot of you have it without your knowledge. But this is the time to be consciously aware that, do I have a support network, and who should I chip in? If I have a crisis, what should happen? So these are the kind of things one should be thinking about. And again, as a psychiatrist, I can't avoid saying this, because this is one of the important questions I ask every patient I come across. Because as a psychiatrist, usually in my first interview, I take 2 hours with the patient. We take all the history. So one of the important questions I ask is, when I'm talking about their personality and about themselves, I ask them, do you have a confiding relationship? A confiding relationship is something where you can confide about your thoughts, your feelings, your worries, your frustrations to somebody. And worries shared or worries halved or quartered, the more, and somebody is able to hold them for you and dissipate for you. And if you're keeping all that worry inside, and it's like a pressure cooker, at some point it will break. But I'm not referring to a few people. There are some people who are highly resilient. Come what may, they are so stubborn, so resilient, and luckily they've got that inherent capacity. Probably those few people may not need those confiding relationships, but a vast majority of us need that confiding relationships. And most of you have it, I'm sure, but it is the time to think, do I have somebody where I can, safely and share my thoughts and feelings? Will that otherwise it is the time to think about and pick up. Sometimes we are very shy, we are reserved, but this is not the time. This is the time to stand for each other and to support for each other. And the other practical thing, again, this is nothing to do with psychiatry, but with my own practical knowledge. When I was in that situation in March, April, one of the things which affected me most initially was the news on the television. These things on the WhatsApp and everything is negative. Everything is negative, this many cases, this many deaths, this much, this. And I was searching for some kind of positivity. So we just need to be very aware to where to source our information from. We should be relying on the reliable networks. And sometimes if we are in doubt, of course, we can't avoid, because there is so much media around, we can't avoid. But you go to the source, the reliable websites and the reliable sources of information, NHS website, the Public Health England website, your local council website, and of course the BBC standard channels like BBC. Those are the places you need to source. And every piece of information which raises your anxiety, try to question, is it true? Why did it not appear on the NHS website? If it is, or somebody comes up with a miracle cure, okay, you take this will be curing. If it is so easy, why did it not come up in the NHS website? So those are the kind of things we need to think about. And then the social media, as I'm saying, it has got its positives and negatives. And I think in a way, the social media is the lifeline in this COVID crisis. It is what is keeping us connected. But at the same time, be aware of the false news or the anxiety provoking news on that kind of social media. So as Deepak said, and also Julie said, there are certain things which are very basic. You don't need a doctor, or you don't need anybody to say. We all know that, but it is very important to reiterate the basic things which will keep us healthy. Nutrition, and again, nutrition also includes here healthy diet, because the scope to move and the scope for exercise is limited. We need to watch our diet so that we are not kind of snacking too much, or eating the calories that are not needed. Exercise is very important. Even if you're at your home, you can do a lot of exercises. It's the motivation that is important. And nothing is prevent, even in a lockdown, nothing is going to prevent us from having a walk in the local area and doing the exercise. Sleep is very important. And for those people who are working from home, try to separate your workplace and your domestic space and your bedroom. You can't use the bedroom for everything. Some people may be exception for this, but it's very important to keep work separate from your family life and your domestic space. And pursuit of leisurely activities. We all think when we are working that, if I'm retired, I will do that, I will do this, I didn't have any time, I have to spend 4 hours commuting every time. Now you don't need to do all that. You have plenty of time. Think about all those pursuits which you wanted to do, and this is the time, and you may not get it again. And as one of the speakers said, things like yoga, relaxation, and thinking about yourself, the mindfulness techniques, these kind of things will boost your health, boost your physical health, and also your mental health. And the other thing which really is an important technique, which appears very simple, but which is a powerful technique, is having a routine. It's very easy to say, it's easier said than done, but where I got the maximum impression of this technique is, I see a lot of people in the prisons, and I assess the mentally disorders offenders for the courts. And prisons are very, very stressful environments, because the liberty is curtailed. You are locked up in a cell for a lot of time in the day. But I come across a small minority of prisoners who function very well in spite of that, the restriction in liberty. When I look at them, those people have a routine. They will say that I will do this. I'm going to read these books. I'm going to watch these films in the television. And I'm going to use this time to write letters. And I'm going to use this time for my exercise. I applied for a job as a cleaner. So they pack their day with something productive. And by the time you lie on your bed in the evening and see what I have done today, my day is filled with productive. If you have the feeling that my day is filled with the productive activity, you feel so contented and you sleep. But if you worry, what did I do today? It's not a good beginning for your sleep, and it's a vicious cycle. So keep a routine and just try to stick to it, and try to put some interesting things in your routine. So these are the kind of things which, what all I said is nothing new, but they could be very powerful. Consistency is very important, and keeping your networks solid is important. And apart from anything, because we're all kind of now part of this forum, West Berkshire Diversity Forum, I was very surprised when Alice contacted me how many local resources are there which I am not aware of. Being a resident in this place for 17 years, I was not aware of. And tap into these resources, and in a way you're not only using the resources, but you're also contributing to those resources. And as a community, we need that cohesion. We need to stand for each other, help each other, and we're all on the same side against COVID. We just need to win. We don't have any other go. So as a last thing, I just want to say, there are other resources for mental health, because you don't need to go to a GP or a psychiatrist. A lot of us have very minor or some kind of marginally severe mental issues, psychological issues, and there are so many helplines. If you go to the NHS website or Public Health England website and type support for mental health, you will get all those helplines. Tap into that, and I'm sure there is help around. It's only that we need to seek for that help. On that note, I got a lot to say. If you allow me, I'll keep on speaking, but on that note, I'll stop, and we will have some more discussion, some more questions in the discussion. Thank you very much, all of you.
Thank you so much, Dr. Rao. Amazing words of wisdom and some testimony, and remarkable. Some of the things you covered, I'm sure lots of people will have experienced. I know I had myself, because I've been in the shielding sort of pattern for a period of time. It mirrors a lot of what Julie was talking about with people who find themselves in a difficult situation on their own. So thank you very, very much for that. And I hope, and this is what I need everybody to now start thinking about, is if you've got particular questions you'd like to bring up to the panel, please start popping them in the chat and we'll try and pick them up. I get the impression we're probably going to run out of time with everything, but this is not a one-off event. This is something that we're going to keep going and hopefully keep growing. We have to get this right for everybody, and we have to keep getting the feedback from all the communities to make sure no one's being left behind.